Well, almost every day we learn something new about COVID-related deaths in nursing homes across New York State. Much of our coverage has focused on the state health department's directive on March 25th, which some say caused more seniors to die from the virus.
But we're also learning about new bills that, if passed, could prevent similar tragedies in the future. Emily Burkhardt joins us live with more of her investigation. Emily?
Benita Mark, these laws would look to establish safe staffing levels, more oversight, and adequate PPE levels. All things direct care workers and their unions have been trying to address for years.
I want you to care. I want you to walk the halls of our facility. I want you to see our patients slumped in bed and crying and wet and soiled. I want you to walk through my facility and not just look at things that may make you more money one day. I want you to look and see my residents. I want you to see my residents as human beings and not money.
That's the message Millette Cooper, a licensed practical nurse of 30 years, has for the CEO of Centers Healthcare, Kenny Rosenberg. She says everyday staff members at Del Mar Center for Rehabilitation and Nursing have to prioritize resident care because they're stretched too thin.
We've actually been told that if we don't like it, we can go somewhere else.
Cooper says they don't even have access to clean towels and washcloths for their residents because management refuses to buy more. Meanwhile, Rosenberg agreed to a 25-year, $100 million loan with his son last fall, allowing him to buy an Israeli airline.
Do you know how much fire that puts, into us? Then they'll go, you know what? We can't even get soap. You know what I mean? And you're buying airlines. They need to have just the basics, toothbrush, a washcloth, a towel. I mean, they stopped buying washcloths a while ago, and it's just these paper washcloths. It's inhumane. It's inhumane the way we're treating them.
These have been issues for years, but all of the attention on nursing home COVID deaths has brought them to the forefront. That's why 1199 SEIU Healthcare Workers East is pushing several new laws they believe will improve care across the nursing home industry here in New York.
We see it as an opportunity to then fix what has been broken for so long.
Millie Silva is the executive vice president of the union. She says they're pushing for legislation that would mandate for-profit nursing homes spend at least 70% of Medicare and Medicaid dollars on direct care. They're looking to improve transparency, particularly with nursing home owners that also own staffing agencies or pharmacies they contract with. They also want to see regular audits with significant financial penalties for companies that fail to meet standards. We've already seen some pushback from the Empire State Association of Assisted Living. Those facilities would be subject to the same new requirements. ESOL says the new measures, coupled with an inability to correct minor infractions without penalty, have many assisted living providers concerned about their continued ability to keep their doors open.
And so if we care about our seniors, we should hold ourselves up to the highest standards of care. And that means that if we don't do what we're supposed to do, that we're willing to pay the price. And if it's increasing penalties as a way to discourage and disincentivize those bad actors in the industry, then that's what we should do. That's what I would want for my mom or for my grandmother, and I'm sure that that's what they would expect for their loved one as well.
If that doesn't convince you investments need to be made in direct care, maybe this will.
People just have to remember, one day they're going to be there. One day it will be you.
Emily Burkhardt, News Channel 13. The company says the statement that Centers Healthcare facilities no longer is purchasing towels, washcloths, or other necessary toiletries is preposterous. All facilities are fully up to code with all necessary toiletries. As for staffing, they say all facilities in the Centers Healthcare family, including Del Mar Center, meet the state-mandated staffing numbers under the guidelines put forth by the New York State Department of Health. If there are holes or gaps in staffing, the company has floating nurses at all times in all regions to fill those vacancies. Centers did not have a comment on the push for new legislation. It's a story we're going to continue to follow for you. Stay tuned to News Channel 13 for updates. Mark, Benita, back to you.
Emily, thank you.